Every 40 seconds, an American has a stroke. Not somewhere abstract, not in a statistic. Somewhere in this country right now, a person who woke up this morning feeling completely fine is watching their world go dark, losing the ability to speak, to move, to recognize their own children. According to the CDC, stroke kills more than 160,000 Americans every year. It is the number 5 cause of death and the number 1 cause of permanent disability in the United States. And the cost, not just in human terms, but in dollars, exceeds $56 billion annually in medical care and lost productivity. But here is what those numbers do not tell you. In the majority of cases, the brain sent a warning, a clear, specific biological signal that something was about to go catastrophically wrong, hours before, sometimes days before. Most people missed it, not because they were careless, because nobody ever taught them what to look for. And the good news, and I mean this, your body is already trying to warn you. The question is whether you know how to listen. I'm Dr. Marcus Reid. I'm 58 years old. I practice out of Boston, and I've spent 3 decades specializing in brain health, neurological aging, and metabolic function for adults in their 50s, 60s, and beyond. I want to be clear about something from the start. I'm not here to sell you supplements. I'm not sponsored by any pharmaceutical company. I'm not going to give you a pill to take and send you home. What I'm going to give you is what your physician genuinely does not have time to explain in a 12-minute appointment: the science of what is happening inside your blood vessels before a stroke occurs, and exactly what you can do about it. At 58, I ask myself the same questions my patients ask me. That is not a weakness. That is why I understand exactly where you are right now. If you want health information explained clearly, the real science, without the sales pitch, subscribe to this channel right now and hit the like button. It takes 3 seconds and it helps this information reach the people who need it most. Now, let us get into this. I want to destroy a myth before we go any further, because this myth is quietly costing lives. The myth is this: stroke is a sudden event, a lightning bolt from a clear sky that strikes without warning, randomly, in people who seemed perfectly healthy the day before. That is almost never true. Here is the reality that most Americans never hear from their doctors. In the vast majority of ischemic strokes, the type that accounts for 85% of all strokes in this country, the event is the final step of a process that took years. The walls of the arteries feeding your brain have been quietly damaged. Cholesterol deposits have been building. The channel through which blood flows has been narrowing, millimeter by millimeter, appointment by appointment, while your labs came back and your doctor said everything looks fine. The stroke is not the beginning of the story. It is the ending. And before that ending arrives, your body has been trying, repeatedly, specifically, to warn you. Before we go further, let me ask you something. How old are you right now? Drop your age in the comments. I read every single one, and it genuinely shapes what I cover next. Let me make sure you understand the 2 types of stroke, because they are completely different events. The first is a hemorrhagic stroke. A blood vessel in the brain ruptures. Blood floods into brain tissue, forms a compressive clot, and the consequences are often fatal. The second, and the one we are focused on today, is an ischemic stroke. The vessel does not rupture, it becomes blocked. Blood flow to a region of the brain stops completely. And here is the number your doctor should be telling you. Brain cells in the affected region begin to die within 4 to 6 minutes of that blockage, not slow down, not weaken, die, permanently and irreversibly. Every minute of delayed treatment costs approximately 1.9 million neurons. That is not a metaphor. That is the published research from the American Stroke Association. Time is not a factor in stroke. Time is the factor. Now I need to explain something that is the foundation of everything else in this video. Picture the carotid artery, the main vessel running up the side of your neck, carrying blood from your heart to your brain. Most people in their 50s and 60s have some degree of plaque forming on the inner wall of that artery. Cholesterol deposits, inflammatory debris. The opening has been slowly narrowing over years. At some point, that already narrowed vessel goes into a brief spasm. Blood flow drops for seconds or minutes. The brain region fed by that artery essentially blacks out for that short window. You experience a stroke symptom. Then the spasm relaxes, blood flow returns, the symptom disappears completely, and you convince yourself it was nothing. In stroke medicine, that event has a name: a transient ischemic attack, a TIA. Transient means temporary, and because it is temporary, most people do not act on it. Here is what the research from Mass General actually shows. A TIA precedes a major ischemic stroke, typically within the following 72 hours. Those 3 days are your intervention window, the window during which the disaster can still be prevented. Most Americans do not use that window. I am going to make sure you do. Let me walk you through the 5 warning signs your brain sends before a stroke. I want you to not just know what they look like. I want you to understand what is physically happening inside your body each time. Warning sign number 1, temporary blindness in one eye. You are walking to the kitchen. Maybe you just sat down with your morning coffee. Suddenly, one eye goes dark, as if someone pulled a black curtain across half your vision. You blink. You rub the eye. Within a minute, the vision returns completely. You blame it on screen time or standing up too fast. Here is what actually happened. A tiny fragment of plaque broke off from the wall of your carotid artery, traveled upward through your circulation, and briefly lodged in the artery feeding the retina of that eye. When it drifted free and blood flow resumed, your vision returned. You felt relieved. You should have felt alarmed, because that same fragment, 2 millimeters in a different direction, would have entered a brain artery, and instead of 1 minute of blindness in one eye, you would be facing permanent loss of speech, paralysis on one side of your body, or death. Neurologists have a classical term for this episode: amaurosis fugax, fleeting blindness, fleeting. When a patient describes it in my clinic, that patient receives urgent evaluation the same day, because the risk of a full stroke in the following hours is measurable and high. The fact that your vision returned is not reassurance. It is a warning that demands an immediate response. Warning sign number 2, sudden numbness or tingling on one side of your body. It can be the entire arm, the hand, half the face, one full side of the body. It feels like pins and needles, like the limb has gone rubbery, like your skin has been wrapped in something that does not belong there. It arrives without warning while you are sitting, walking, or mid-conversation. It lasts a few minutes, then it is gone. Here is the critical clinical detail: one-sidedness. Each hemisphere of your brain controls and processes sensation for the opposite side of your body. When a vascular event temporarily disrupts one hemisphere, the symptoms appear on one side only. That asymmetry is the signal. When both hands go numb symmetrically, that more often points to a cervical spine issue. But sudden numbness affecting only your right arm or only the left side of your face, resolving on its own within minutes, is a vascular warning until a physician confirms otherwise. Do you want to do a quick self-assessment right now? Close your eyes. Brush your fingertips lightly down both arms from shoulder to wrist. Do both sides feel identical? Any difference in sensation, more muted on one side, more tingling on one side, is worth noting and bringing to your next appointment. Warning sign number 3, sudden loss of coordination. People describe it as walking drunk without having consumed any alcohol. You are on a flat, completely familiar surface and your foot lands in the wrong place. Your leg feels rubbery, you stagger into a wall, or you are hit by a sudden, intense spinning sensation that makes you grab for something to steady yourself, with no obvious trigger, no head movement, no positional change, just sudden vertigo that came from nowhere. The structure responsible for balance and coordinated movement is the cerebellum, a dense cluster of neural tissue sitting at the base of your skull. Think of it as your body's internal GPS system. It calculates where every part of you is in space, every second, and adjusts your movement accordingly. The cerebellum gets its blood supply from arteries that travel up through the bones of your neck into the back of your head. When flow through those arteries drops sharply, even briefly, the cerebellum glitches. That is the moment you stagger, misstep, or experience violent dizziness with no external cause. Benign dizziness has a trigger: rolling over in bed, a known inner ear condition, standing up quickly from a seated position. Spontaneous, intense dizziness combined with any difficulty walking in a straight line is a vascular warning until proven otherwise by a physician. Warning sign number 4. Sign number: a sudden breakdown in speech. I want to be precise here because I hear this concern misapplied constantly, occasionally forgetting a neighbor's name, losing a word temporarily when you are tired, taking a moment to retrieve something from memory. That is normal. That happens to every person in their 50s and 60s, including me. That is not what I am describing. What concerns neurologists is sudden, dramatic speech failure that surprises even the person experiencing it. There are 2 primary language regions in most brains. The first helps you produce words and send instructions to the muscles of your tongue and lips. When this region loses blood flow, you understand everything being said to you. You know exactly what you want to say, but you cannot get the words out. They come out fragmented, slurred, or not at all. The second region helps you understand speech and organize your own sentences so they make sense. When this zone is disrupted, a person may speak fluently, but produce complete nonsense, a stream of words that carry no meaning, and may be unable to follow simple instructions. Either presentation, appearing suddenly and then resolving after a few minutes, is a classic TIA. The resolution does not make it less serious. It makes it more urgent. Your brain just told you it lost its blood supply. Treat that message accordingly. Warning sign number 5. This one surprises most of my patients. It is the combination of vitiligo, the autoimmune skin condition causing patches of depigmented whitened skin, with new, unusually intense headaches that do not fit your normal pattern. Here is the mechanism. Vitiligo is an autoimmune process. The immune system begins attacking pigment-producing cells as if they are foreign tissue. But when the immune system misfires against one tissue type, it frequently does not stop there. In a significant proportion of people with vitiligo, that same autoimmune inflammation also targets the endothelium, the microscopically thin layer of cells lining the inside of your arteries. Think of the endothelium like the non-stick coating on a good pan. When that coating is intact and healthy, nothing adheres to it. Blood flows smoothly. When it is inflamed and damaged, it becomes rough. Cholesterol, platelets, and inflammatory proteins begin to accumulate, forming the seeds of arterial plaques over months and years. Vitiligo alone does not predict stroke, but vitiligo combined with new atypical headaches, headaches that have changed in character, intensity, or frequency from what is normal for you, warrants a proper vascular workup, not a wait-and-see approach. Now, I want to address what is actually damaging your blood vessels over the years that precede a stroke, because this is where the most dangerous myth in American medicine lives. The myth is, my cholesterol is normal, so I am safe. I hear this every week in my clinic, and every week I have to explain why it is incomplete. Stroke risk is not determined solely by what is circulating in your blood. It is determined in large part by the condition of the endothelial lining of your arteries, and that lining can be severely compromised long before your cholesterol panel raises any flags. The first major enemy of the endothelium is chronically elevated blood sugar. Here is the American reality. According to the CDC, more than 96 million Americans have prediabetes. That is 1 in 3 adults, and 80% of them have no idea. Here is why that matters for your brain. Glucose needs insulin to enter your cells. When cells become insulin resistant, which happens gradually, quietly over years, glucose accumulates in the blood while your endothelial cells are effectively starving. Starving endothelial cells lose their integrity. They become damaged. They create rough, scarred patches on your arterial walls that become adhesion sites for cholesterol and clots. This process begins in the pre-diabetic range. An HbA1c of 5.8, which your doctor may have told you is fine, has been associated with measurable endothelial damage in published research. Fine is not the same as optimal, and the difference matters when we are talking about the arteries feeding your brain. The second major vascular enemy is smoking. Every cigarette delivers toxic compounds directly to the inner surface of your arteries, causing acute inflammation and endothelial damage. Simultaneously, nicotine and carbon monoxide make blood thicker and stickier. Smokers carry 2 to 4 times the ischemic stroke risk of non-smokers with otherwise similar risk profiles. That is not a range estimate. That is the research. Blood pressure requires more nuance than most Americans receive. Yes, chronically elevated blood pressure damages vessel walls over years and dramatically accelerates plaque formation. It is also the primary driver of hemorrhagic stroke, where a vessel wall weakened by years of pressure, stress finally ruptures. But here is what most people are never told. An ischemic stroke often does not occur at peak blood pressure. It occurs at a relative low point. Picture an artery already narrowed by 60% by plaque. As long as your systemic pressure is high enough, blood pushes through that tight segment. But when pressure drops, naturally during sleep, when your body enters its normal nightly dip of 15 to 20%, the flow through that narrowed point can fall to near zero, particularly if a small clot has formed on the plaque surface while you were lying quietly. This is why some people go to bed feeling completely well, and someone finds them unable to speak in the morning. I want to share something with you. A patient I will call David, 64 years old, retired engineer from outside of Philadelphia. He came to see me 18 months ago. He had experienced 2 brief episodes over the previous year where his right hand went numb and tingly for about 3 minutes. Both times it resolved completely. His internist had attributed it to his desk posture. David told me, and I remember this clearly, "Dr. Reid, I almost didn't come. I figured it was nothing. Both times it went away." We ran a carotid ultrasound. His left carotid artery was narrowed by 74%. He was 72 hours from a major ischemic stroke at any moment. He had a carotid endarterectomy 3 weeks later. Today he is coaching his granddaughter's soccer team. The warning signs came. He almost talked himself out of them. He did not. That decision gave him years. If you have experienced any of the 5 warning signs I described, even once, even briefly, even months ago, here is what the next 72 hours should look like. Do not be alone. Tell someone close to you what you experienced. Make sure someone can reach you quickly if another episode occurs. If you suddenly lose the ability to speak or feel arm or leg weakness, you need another person present who can call 911 immediately and get you to care. Do not drive yourself for evaluation. A loss of vision or motor control lasting even 3 seconds at highway speed is catastrophic for you and everyone around you. If you or someone near you can measure blood pressure and the reading shows a systolic at 180 or above with a diastolic at 110 or above, that is a hypertensive crisis, not simply elevated pressure. In the context of a suspected TIA, that reading warrants calling 911, not scheduling an appointment. One absolute rule from stroke medicine: never begin blood thinners on your own. Aspirin, anticoagulants, anything you read about online. There are 2 types of stroke. In ischemic stroke, blood thinners may help. In hemorrhagic stroke, they can accelerate the bleeding and cause death more rapidly. The only way to distinguish them reliably is brain imaging in a hospital. Get evaluated. Let a medical team make that determination. There are 3 tests I want you to write down right now and request at your next appointment. All 3 are covered by Medicare and most standard insurance plans. Test number 1, carotid duplex ultrasound. This imaging shows both the structure of your carotid artery and the flow characteristics of blood moving through it. If the artery is narrowed by more than 70% by plaque, that is a hemodynamically significant stenosis. The clinical question at that point is not whether a stroke might occur. It is when it will occur if nothing changes. Test number 2, glycated hemoglobin, HbA1c. Unlike a fasting glucose test that reflects a single morning snapshot, HbA1c reflects your average blood sugar over the preceding 3 months. It is the most reliable tool available for detecting the pre-diabetic range, where blood sugar has been elevated long enough to damage your endothelium without yet triggering a formal diagnosis. Below 5.7% is normal. Between 5.7 and 6.4% is prediabetes. At 6.5% or above, the threshold for diabetes is met. If you have never had this test, or it has been more than a year, that conversation with your doctor is overdue. Test number 3, 24-hour Holter monitoring, a continuous heart rhythm recording you wear during a normal day. The reason a brief clinic ECG is insufficient is that the most dangerous rhythm problem for stroke, atrial fibrillation, is frequently intermittent. It may occur twice a day for seconds at a time and be completely invisible on a 10-second tracing. In atrial fibrillation, the upper chambers of the heart stop contracting in an organized rhythm and begin quivering chaotically. Blood churns rather than flows. Clots form in that turbulent environment and travel to the brain, causing what we call cardioembolic strokes, which tend to be among the most severe and most disabling. Many people with atrial fibrillation feel nothing dramatic. Occasional skipped beats, a flutter they attribute to caffeine. Holter monitoring is what catches it. And if atrial fibrillation is found, anticoagulant medications, when properly prescribed and monitored, reduce stroke risk in this condition by 60 to 70%. That is not an inevitable outcome. That is a risk you and your cardiologist can actively manage. When you ask your doctor for these tests, here is exactly how to phrase it. I'd like to establish a baseline for my cerebrovascular and metabolic risk. Can we add these to my next visit? Most physicians will agree. And if yours pushes back significantly, that is information too. One warning before we close. And I say this because I see it constantly. Around day 3 or 4 of any new health protocol, whether it is dietary changes, blood pressure management, or simply paying closer attention to your body, something happens. You start to feel better, and your brain immediately says, I figured it out. I can go back to normal. Do not. Feeling better is not the same as the underlying vascular process being resolved. It is your body's first response to removing an irritant. The real repair, the kind that shows up in your carotid ultrasound, in your HbA1c, in how your brain functions at 70. That happens over months, not days. Stay the course. Let me close with what I want you to carry out of this video. Stroke is not a lightning bolt from a clear sky. It is a predictable conclusion to a process that begins years earlier, and it announces itself in advance. You now know the 5 signals: temporary blindness in one eye, sudden one-sided numbness or tingling, abrupt loss of coordination, sudden serious speech breakdown, vitiligo combined with new atypical headaches. Any of these, appearing for the first time, even if they resolve within a minute, is a reason to contact a physician urgently. Here is what I want you to do in the next 24 hours. Number 1, write down any of the 5 warning signs you have experienced, even months ago. Plain language, specific dates if you remember them. Bring that written description to your next appointment. Number 2, ask your physician specifically about carotid duplex ultrasound, HbA1c, and Holter monitoring. Number 3, if you have risk factors including prediabetes, elevated blood pressure, smoking history, or an autoimmune condition, have a direct conversation with your doctor about your personal stroke prevention plan. Not a general conversation, a specific one with numbers. Everything I covered today is for your education. Your situation is unique. Use this as a starting point for a real conversation with your physician, not a substitute for one. If you are serious about protecting your brain as you get older, subscribe to Dr. Marcus Reid, hit the bell, and share this with someone in their 50s or 60s who needs to hear it. I will see you next Friday. We are going to cover why you cannot sleep after 55, and I promise, what I am going to show you about what is actually happening in your brain between 2 and 4 in the morning is going to change how you approach the next decade of your health. Take care of yourself. I mean that. I am Dr. Marcus Reid. This content is for educational purposes only and does not constitute medical advice. Always consult your physician before making any changes to your health routine.